The muscles of the face are very important in expressing emotions. When these muscles get paralyzed, it could result in distressing symptoms or clinical features. One such image we can see here. This is a patient with Bell's palsy or injury to facial nerve. Now, there is a deformity of the face produced by paralysis of the muscle, which could be very disturbing or distressing to these patients. What is the cause for such deformity? Such deformities are caused by facial nerve injuries. And in this session, let's focus on the detailed anatomy of facial nerve and what happens when facial nerve gets injured. We will learn its clinical anatomy. The learning objectives of this session are, by the end of this session, you should be able to describe the type of facial nerve, whether it is a sensory nerve, a motor nerve, or a mixed cranial nerve. Then, you should be able to describe the functional components of the facial nerve, what are the fibers present in it. What about the nuclear origin of the facial nerve? What are the nuclei associated with facial nerve? Then, the superficial origin or attachment to the facial nerve to the brainstem, the course and relations of the facial nerve, intracranial as well as extracranial, then branches and area of distribution, where all it supplies, what are the structures supplied by it, then what is the anatomical basis for facial nerve palsy, what is upper motor neuron lesion, lower motor neuron lesion, Bell's palsy and anatomical basis for it, and then finally, how do we identify the site of lesion in case of facial nerve palsies? Can we do it without any investigation? These are the learning objectives. Now, whenever we learn about a particular cranial nerve, you can use a common template for learning. You can use common headings so that the learning of the cranial nerve becomes a lot easier. Now, first we'll try to use this template and apply it for facial nerve. Now, let's write down what are the headings under which we should be learning any cranial nerve or facial nerve. Always begin with little bit of introduction to the cranial nerve. Now, what will you write or what will you need to know in introduction? In introduction, you should know the number of cranial nerve. Which cranial nerve is it? First, second, third, fourth, like that. Right? Once you know the number, next important thing is to know what type of cranial nerve is it. Whether it is purely sensory nerve, purely motor nerve, or it's a mixed nerve containing both type of fibers. Once you know this, the next thing is to learn about the functional components. You should know what are the functional components present in each cranial nerve. Now, this could be somatic efferent, visceral efferent, somatic afferent, visceral afferent. We know that there are 7 functional columns. Out of these 7 functional columns, which functional component is present in each of the cranial nerve? Once you know this, what are the nuclei that represent it? We call it as deep or the nuclear origin. Each functional component is represented by a nucleus which is located in brainstem. Where exactly it is located and what is its function? That's what you need to know in deep origin or nuclear origin. Once you know this, the next thing is to know about the superficial origin. Now, what do we mean by superficial origin? This refers to the exact site of attachment to the brainstem. Where exactly it is attached to the brainstem? Which part of the brainstem is attached? Whether it is attached to the midbrain or is attached to the pons or the medulla. Right? So that is what you will know in superficial origin. Once you know this, the next heading is to learn about the course and relations. And this is one of the dreaded part in each of the anatomical structure that we study, right? The scariest part. But when you learn about course and relation of any cranial nerve, always remember these 2 headings. You can learn it under 2 headings. One is its course within the cranial cavity, which we refer to as the intracranial course, right? It has to come outside the cranial cavity. And what is that course referred to as? It is referred to as extracranial course. Remember, if you are talking about a sensory nerve, it will enter the cranial cavity. If you are talking about a motor cranial nerve, it will exit. In either case, it will require one or the other foramina in the skull to either enter or exit. And that is what you need to remember exactly in core scintillation. Right? Then, this should be followed by branches. What are the branches the nerve will give off? And the area of distribution. What area it supplies, what structures it supplies, whether it supplies muscles, whether it supplies glands, right? So that's what you need to know in branches and area of distribution. Once you know this, the last thing is to mention about the clinical anatomy. Right? Now remember these 7 headings, and using these 7 headings, you can learn any of the cranial nerve. Right? We will apply this for facial nerve, and let's make the learning of facial nerve a lot more easier. We'll begin with introduction to facial nerve. Now, first thing in introduction is to number the cranial nerve. Can you tell me facial nerve is which cranial nerve? Very good. It is the 7th cranial nerve. Fine. So, facial nerve is the 7th cranial nerve. Remember, when you write the number, always use the Roman numerical. Fine? Never use the Arabics. Right? So, cranial nerves are always represented in the Roman numerical. So, this is the 7th cranial nerve. And what type of nerve is facial nerve? Is it a sensory nerve, a motor nerve, or a mixed nerve? Facial nerve is an example for mixed type of cranial nerve. So, it is an example for mixed cranial nerve. What do we mean by this? It has both sensory component as well as motor component. Right? Remember, we had discussed about one important mnemonic to remember the types of cranial nerves. Do you remember it? Now, let's try to write it down. It goes like this, right? Some say marry money, but my brother says big brains matter most. Right? So, we have the first cranial nerve, which is sensory. Remember, S stands for sensory, M for motor, and B for both or mixed. So, we have the olfactory nerve, then optic, then we have the oculomotor, trochlear, trigeminal, then we have abducent, and then here we have the facial nerve. So, what type of cranial nerve is facial nerve? It's an example for a mixed cranial nerve. Right? Fine. Anything else that we need to know here? This is the nerve of second pharyngeal arch. Facial nerve is the nerve of second pharyngeal arch because it supplies all the muscles that are derived from second pharyngeal arch. All the muscles of facial expression are supplied by facial nerve. Now, these are few introductory points you need to know regarding the facial nerve. After this, let's focus on identifying the functional components. Now, one of the common mistakes we do when learning functional components is we try to mug it up. We need not do that, right? Now, let's try to identify the functional component, but checking out all the 7 functional components for the presence in facial nerve. In order to do this, first, let's write down all the functional components. Since facial nerve is a mixed type of cranial nerve, it should have both afferent columns and efferent columns, right? So, we will write the columns first. Always begin with the visceral columns. So, we have general visceral efferent column. GVE stands for general visceral efferent column, right? Then we have special visceral efferent column. Then we have general somatic efferent column, right? Similarly, the afferent columns are, we have the general visceral afferent, special visceral afferent, general somatic afferent, and special somatic afferent. Now, let's see if we can rule out some of these functional components. The general somatic efferent column, what is its function? Remember, it supplies the skeletal muscles. It supplies the skeletal muscles derived from somites. Somites in the cranial region. Now, what are the muscles which are derived from cranial somites? These are the muscles of the eye, the extraocular muscles and muscles of the tongue. And we know that the facial nerve will neither supply the muscles of the eye nor the muscles of the tongue. So we can easily rule this out. So this column is not present in facial nerve. Similarly, when we talk about special somatic afferent column, we know that this is concerned with two important functions. One is hearing and the other one is the equilibrium, which is associated with the vestibulocochlear nerve. Right? So we can even rule out this functional column. Now we have narrowed it to 5 functional columns, and let's try to decide which of these functional components are present in facial nerve. What is the function of special visceral efferent column? Special visceral efferent column, if you remember, supplies the muscles derived from branchial arches. Muscles of branchial arch, and facial nerve indeed will supply the muscles derived from second pharyngeal arch. So this is one component which is present in facial nerve. So facial nerve has special visceral efferent column. Similarly, what about general visceral efferent column? We know that the general visceral efferent column normally represents the autonomic part of nervous system, and it supplies glands, smooth muscles and cardiac muscles. Facial nerve will not supply cardiac muscle, right? Facial nerve may not supply smooth muscle, but facial nerve will definitely supply glands. And what glands does it supply? Facial nerve will supply the salivary glands. What salivary glands? It will supply submandibular gland and sublingual gland. It even supplies the lacrimal gland and glands of the soft palate, including glands of the nose. So it will have what component? It will have the general visceral efferent component. Right? Now let's see about general visceral afferent column. The general visceral afferent column, as we know, will carry the impulses, the sensory impulses from the viscera, that is smooth muscle, cardiac muscle or glands. Remember, facial nerve is only motor to the glands of the head and neck. It never carries sensory impulses back from them. Fine? So this functional column is not there in facial nerve. Right? What about special visceral afferent column? Special visceral afferent column carries the sensation of taste. General visceral afferent column, I said, this is about general sensations. Right? The taste sensation is carried ultimately by the special visceral afferent column. Facial nerve, will it carry taste from the body or taste from the tongue? Yes, it carries taste sensation from anterior 2/3 of the tongue by chorda tympani. So it will have even this column. Right? Finally, we have general somatic efferent column. General somatic efferent column represents the sensation that is derived from skin. Facial nerve, will it innervate skin of the head and neck? There is a small part of skin over the external ear, in particularly over the conch of the ear, which carries sensation from the facial nerve. Fine? So this is regarding cutaneous sensation. And as I said, a small portion of your external ear over the concha is indeed innervated by the facial nerve, and hence this column is also present in facial nerve. So to summarize, facial nerve will have 4 functional columns. What are they? It has special visceral efferent column which supplies the muscles of the face, general visceral efferent column which will supply the submandibular gland, sublingual gland, glands of the palate, lacrimal gland and also glands of the nose. Then it will carry taste sensation from anterior 2/3 of the tongue via special visceral afferent column. Then general somatic afferent column which is concerned with carrying cutaneous sensation from the conch of the ear. Right? This is how we need to identify the functional columns. So don't try to mug up this. Try to analyze the function of each of the functional columns. Then it becomes a lot more easier for identifying the functional components present in each of the cranial nerve. Right? Once we have learned this, let's try to identify these functional columns are represented by what cranial nerve nuclei. Now what you see here is a sagittal section of the head and neck, seeing the medial surface of the brain and also other structures of the pharynx and oral cavity. But here the region of interest for us is the brainstem. This is the midbrain, right? And then we have the pons, and finally we have the medulla. right? So in this three part of brainstem, where exactly the facial nerve nuclei are located. Now first important nuclei of facial nerve is located in pons. And what is this nucleus? We call this as the motor nucleus of facial nerve. And what functional column does it represent? This represents the special visceral efferent column that supplies the muscles of branchial arches. Right? Then, after motor nucleus, there is one more important nucleus which is located in the pons itself. And what is this? This is the superior salivatory nucleus. So this is referred to as superior salivatory nucleus. And what functional column this represents? Remember, this represents the general visceral efferent column. Right? Now, superior salivatory nucleus will supply the submandibular salivary gland, the sublingual salivary gland. In addition to this, a small nucleus itself is present in the caudal part of the pons, and this is referred to as the lacrimatory nucleus. So this is referred to as lacrimatory nucleus, and this also represents the general visceral efferent column, but the fibers from the lacrimatory nucleus will innervate the lacrimal gland in particular. Right? This is regarding the nuclei that represents efferent column. Similarly, the afferent column nuclei are in the medulla oblongata. We have one important nucleus in the medulla oblongata, and this nucleus is referred to as NTS, nucleus tractus solitarius. This is concerned with carrying taste sensation from anterior two-thirds of the tongue. So what fibers are present in it? Special visceral afferent fibers. Remember, nucleus tractus solitarius is an afferent nuclei which is present in the medulla oblongata. Then what? One more important sensory nucleus, a nucleus referred to as the spinal nucleus of trigeminal nerve. The importance of this nucleus is it is not only present in the medulla oblongata but also extends into the pons and even midbrain. So what is this nucleus? This nucleus is the spinal nucleus of trigeminal nerve. And what functional column does it represent? This represents general somatic afferent column, which is concerned with carrying cutaneous sensation from the external ear over the concha. This is regarding the deep origin. So what you should know in deep origin? The name of the nucleus, the position of the nucleus, and the fibers contained within the nucleus or the function of that nucleus. Right? So this is regarding the functions or locations of the facial nerve nuclei. Once we know this, let's try to understand how exactly the facial nerve originates. Facial nerve has different nuclei, and these nuclei give rise to different set of fibers. But these sets of fibers are organized as two roots. Okay? So the facial nerve will arise by two roots. It is known as the motor root and sensory root. So these are the roots of facial nerve. Right? The sensory root of the facial nerve is also referred to as nervus. It is known as nervus intermedius. It is known as the nervus intermedius, or also known as the nerve of Risberg. Right? Some of the authors even describe the sensory root as the 13th cranial nerve. Now don't worry too much about this. Some of the authors in fact describe the sensory root as the 13th cranial nerve. Fine? So this is nervus intermedius. Now let's try to understand where exactly it is attached to the brainstem. Now what we see in this image is the inferior surface of the brain, which will give attachment to cranial nerves. Right? Again, let's try to identify different parts of the brainstem here. We have the anterior part of midbrain, right? And what is this structure? This, as we know, as pons, right? And what about this? This entire structure is the medulla oblongata, right? In order to identify the attachment to the facial nerve, we need to identify one more important landmark here. That is the junction between the pons and the medulla oblongata, which is referred to as the pontomedullary junction. Right? The two roots of the facial nerve are attached to pontomedullary junction. Let's try to understand how. Pontomedullary junction give attachment to three important cranial nerves. One medially, there is one laterally, and facial nerve, remember, is present in between this. So it has a large root which is present medially, right? And it has a small root which is present laterally. Now what are these two roots? Remember, this is the motor root which is large and present medially, and then this is the small sensory root. Now why we need to know this? In case of facial nerve, the motor root is larger because the main function of the facial nerve is to innervate the muscles of the face, whereas the sensory component has a smaller function. Now compare this with the trigeminal nerve. Trigeminal nerve is the chief sensory nerve of the face. So in case of trigeminal nerve, the sensory root is larger. But even in trigeminal nerve, if we observe the attachment, let's imagine this is where the trigeminal nerve is attached. The trigeminal nerve will have a small motor root which is present medially and a large sensory root which is present laterally. Right? Now, why I am telling all this is, remember the position of the two roots very clearly because this has been very frequently asked even in your entrance exam. Which root is medial in case of facial nerve or trigeminal nerve? Always remember M for M. Motor root is always medial. Let it be facial nerve or let it be trigeminal nerve. Fine. The only difference is the motor root is larger in case of facial nerve, whereas in case of the trigeminal nerve, the sensory root is larger because of its function. Fine. So this is what you need to know regarding attachment to the facial nerve. Facial nerve arises by two roots, a large motor root which is present medially in the pontomedullary junction and a small sensory root which is present laterally. And the nerve is attached between two nerves on either side. On medially we have the abducent nerve. So what is this nerve? This is the 6th cranial nerve. And what is this? This is the 8th cranial nerve. Fine. So this is what you need to write or learn regarding the superficial attachment of facial nerve. Right? Once we know this, let's focus on the course and relations. As I said, this is the most scariest part in any of the anatomical structure. But remember, for any of the cranial nerve, I described two headings under which we need to learn this. Now what is that? You can remember it as intracranial. You can remember it as intracranial. That is part of the cranial nerve that is present inside the cranial cavity. Let it be sensory or motor. Some part of the cranial nerve will always be present inside the cranial cavity, and then the other part will be present outside the cranial cavity, and you can describe this as the extracranial course. Right? In case of facial nerve, there is a slight peculiarity. Right? The intracranial course can be further divided as cisternal. We call this as cisternal or cranial component, and then there is one more division that is referred to as intratemporal. Facial nerve will not directly exit through any of the foramens of the skull. Instead, what it does is, it passes through the middle ear, and that portion which passes through the middle ear is what we refer to as intratemporal portion. Because we know that the middle ear is present in the temporal bone, inside the temporal bone. Fine. So this is the further subdivision of the intracranial course. Then the intratemporal course is further subdivided into meatal. There are different segments. These are different segments of the intratemporal part of facial nerve, right? So it is meatal segment. Then we have the labyrinthine. We have the labyrinthine segment. Then there is a tympanic segment. And finally we have a mastoid segment. These two segments are also referred to as horizontal and vertical segments. We will see this in an image. But this is how you can group or classify the entire course of facial nerve. First, intracranial and extracranial. Intracranial is divided as cysternal and intratemporal further has 4 different segments. Right? Now let's focus on identifying these parts of the facial nerve. Now this is a section of the middle ear showing the ear ossicles, the muscles, and along with that the course of the facial nerve shown in yellow color. Now let's try to identify the different segments of facial nerve in this component. Now what is this component? This is the intratemporal part or the intratemporal component of facial nerve. What about the cysternal component then? Remember, the cysternal component of facial nerve will extend from the site of origin, that is pontomedullary junction, to the internal acoustic meatus. So this is what we refer to as the cysternal part. So remember the extent of the cysternal part from origin till it reaches the internal acoustic meatus. Now this is an important functional aspect within the base of the skull or the cranial cavity. Internal acoustic meatus is a small opening or a canal which is present in the temporal bone, and there are 3 important structures that will pass through this. One is facial nerve, the roots of the facial nerve, then vestibulocochlear nerve and labyrinthine vessel. Now this is asked very frequently in your practical exam. They will point the internal acoustic meatus and they will ask you to write what are the structures present inside it. So remember, the 3 structures that passes through internal acoustic meatus are facial nerve, the 2 roots of facial nerve, vestibulocochlear nerve and labyrinthine vessels. Right? This is regarding the cysternal part. Then when we come to the intratemporal part as seen in this image, it is divided into 4 segments as I mentioned. What are they? Now this segment which passes through the internal acoustic meatus, this is what we refer to as the meatal segment. Right? Because it is present in internal acoustic meatus, it is referred to as meatal segment. And it is within this internal acoustic meatus, the 2 roots of the facial nerve will fuse. That is, sensory root and motor root will fuse here at the internal acoustic meatus. Then the next segment is what we refer to as the labyrinthine segment. This is referred to as the labyrinthine segment. Right? We will identify the peculiarity a little bit later. Then the labyrinthine segment undergoes a bend. Can you see this bend? Now this bend is what we refer to as the genu. This is the first external genu of the facial nerve, right? Where the labyrinthine segment will continue as the tympanic segment or the horizontal segment. Now this segment is what we refer to as the tympanic segment. The tympanic segment is also referred to as what? Horizontal segment because of its horizontal course, right? And then rest of the part of the facial nerve, this part is what we refer to as the vertical segment, otherwise referred to as the mastoid segment. Vertical or mastoid segment. The tympanic segment will become mastoid segment at one more bend. Can you see this? Here is one more bend, and this bend is what we refer to as the second external genu. Now, I am consistently using the term external genu. Why? Because there is something called as internal genu. Now, what do we mean by internal genu? The fibers of the facial nerve, the motor fibers, when they take their origin from the pons, that is from their motor nucleus, they wind around the abducent nucleus. So that is known as internal genu. The bending of the fibers around the abducent nucleus within the pons is what we refer to as internal genu, whereas external genu is present within the middle ear. There are 2 external genus. The first external genu where labyrinthine segment becomes the tympanic segment. The second bend or the second genu is where we have the tympanic segment continuing as the vertical segment or the mastoid segment. Right? As I said, each of these segments have some peculiarity. Now, what are these peculiarities? Let's begin with the meatal segment. The meatal segment, as we learned, is present within the internal acoustic meatus. The peculiarity of the meatal segment is this lacks a neurilemmal sheath. This lacks the endoneurium, right? Instead, it is covered by thin arachnoid matter. That is the peculiarity of the meatal segment. Then, when we come to the labyrinthine segment, we described it as the shortest segment. Labyrinthine segment is the shortest segment, and one important feature is the labyrinthine segment has poor vascular supply. So this particular part, that is labyrinthine part, is more prone for ischemic injuries. Right? So these are two important peculiarities that you need to remember. Right? One is regarding the meatal segment, which lacks the neurilemma and endoneurium, and then the labyrinthine segment, which is the shortest segment and is more prone for vascular compressions because of its poor arterial supply. Right? Then we spoke about the mastoid segment as the longest vertical segment. This is what you need to know regarding the intratemporal part of the facial nerve, the different segments. If you can mention about the names and little bit about each of these parts, that is what we expect from the intratemporal or the relations within the middle ear cavity. Right? Fine. Now, we need to end the intracranial course with a foramen. All cranial nerves should exit or entry through a cranial foramen, and even facial nerve does the same. So, how it exits the skull? It exits the skull through a foramen which is present in the base of the brain. And what is that foramen? This is the foramen referred to as the stylomastoid foramen. Right? This is the stylomastoid foramen. Right? So, facial nerve exits its intracranial course by passing through stylomastoid foramen. Once it comes out of the stylomastoid foramen, the rest of the course of facial nerve is what we describe as the extracranial course. Right? As we can see in this image, we can see the facial nerve is exiting through the stylomastoid foramen. Right? Once it is exiting through the stylomastoid foramen, it is passing below the external ear within the substance of the parotid gland, and immediately it is splitting into two trunks. These are the important things to remember. Once it exits the skull, it passes anteriorly and enters the substance of parotid gland. Right? And within the substance of the parotid gland, right, if we write, let's say this is the outline of the parotid. Right? So, within the parotid gland, it will divide into two trunks. As we can see, this is described as temporofacial trunk. Right? That is the temporofacial trunk, and this is referred to as the cervicofacial trunk. Cervicofacial trunk. After this, both the trunks will give plenty of branches which will anastomose and form a plexus, and that plexus is what we refer to as pes anserinus. Remember, we use the term often as the 5 terminal branches of the facial nerve, but that is not true. Pes anserinus basically refers to the plexus formed by the branches of the facial nerve, and from this pes anserinus we will have 5 terminal branches. These 5 terminal branches are, this is the temporal branch, right? This is the temporal branch, and then we have the zygomatic branch. This is the zygomatic branch, and then there is a buccal branch. So this is the buccal branch. Often our textbooks describes that there are 2 buccal branches, but according to the latest edition of Gray's Anatomy, there is often a single buccal branch, and there are 2 marginal mandibular branches. Right? So remember this important point. This is the marginal mandibular branch. Marginal mandibular branch, and usually these are 2 in number. And marginal mandibular branch basically supplies the muscles of the lower lip. And then the last terminal branch is the cervical branch. Cervical branch supplies only one muscle, that is platysma, muscle of the neck. This is regarding the extracranial course and branching pattern. One important point you need to remember, the facial nerve will pass through the substance of the parotid gland where it is related to the external carotid artery and retromandibular vein, and it divides into these 5 terminal branches. This is what you need to know, remember and learn regarding the course and relations of the facial nerve. Right? Once we have learnt about course and relations, let's try to identify the different branches. Now, this is a section showing the brainstem along with different fibers present in facial nerve. Now, first try to label the important structures and then we'll try to identify the branches. Okay? So, what we have here is, this is the pons, this is the medulla oblongata, right? We have the sensory root, and here is the motor root of facial nerve, right? We have the trunk of the facial nerve formed within. Can you tell me what is this structure? This is the internal acoustic meatus. As I mentioned, the two roots unite at internal acoustic meatus, and then we have the trunk of facial nerve. And there is one more important structure here. This is the genu. Fine. At the first genu, we have a swelling, and that swelling is referred to as geniculate ganglion. Right? Then we have the different branches coming from facial nerve. Right? Now let's try to identify these branches. Remember, the branches of the facial nerve can be grouped as intracranial, and extracranial. Right? Now let's focus on the intracranial branches. The first intracranial branch, as we see here, is this nerve. And what is this nerve? This is the greater petrosal nerve. Fine? As we can see, greater petrosal nerve arises from the geniculate ganglion and it is innervating the lacrimal gland. Fine? So what is this? This is the lacrimal gland, and here we have the soft palate. Right? So what is this greater petrosal nerve? Now let's try to trace the fibers that are present in greater petrosal nerve. Now in the medulla oblongata, we learned that there are two nuclei. Right? What are these two nuclei? This is the spinal nucleus of trigeminal nerve, and what is this? This is the nucleus tractus solitarius. Right? Then when we come to the pons, we have the motor nucleus. This is the motor nucleus, and here we will have a nucleus that is referred to as superior salivatory and lacrimatory nucleus. So as you can see, the fibers of the lacrimatory nucleus, let's try to trace it, are passing through the sensory root of the facial nerve, then through the meatus, passing through the trunk of the facial nerve, and through the geniculate ganglion leaves as the fibers within what nerve? Greater petrosal nerve. Right? And this greater petrosal nerve is joined by one important nerve here known as the deep petrosal nerve. The rest of the nerve we refer to as Vidian's nerve or nerve of pterygoid canal. What is the fate of this nerve? These fibers, they terminate within the pterygopalatine ganglion. This is the pterygopalatine ganglion. The postganglionic fibers, as we can see, pass through the zygomatic or the lacrimal nerve and supply the lacrimal gland, and will also supply the soft palate through the branches of maxillary nerve. This is the function of greater petrosal nerve. Greater petrosal nerve carries secretomotor fibers from the lacrimatory nucleus to the pterygopalatine ganglion. From the pterygopalatine ganglion, it supplies or innervates lacrimal gland and glands of the soft palate. Right? This is regarding greater petrosal nerve, the first intracranial branch. So let's write this. The first intracranial branch is greater petrosal nerve, and we learnt about its function. The second important branch it gives a branch to one of the muscle in the middle ear, and this is the nerve to stapedius. So this is the second branch. What is the second branch? Nerve to stapedius. Right? What is the function of nerve to stapedius? As the name suggests, this will supply stapedius muscle. What is the function of stapedius muscle? Remember, stapedius muscle prevents our internal ear and middle ear from loud sounds. Right? It prevents the phenomenon of hyperacusis. What is hyperacusis? In hyperacusis, you will hear even whispering sounds as very loud noises. So stapedius is important for stapedial reflex, which will prevent or protect our middle ear from loud noises. That is the function of nerve to stapedius. Then we have one more important branch, and this branch is known as the chorda tympani. Right? So the third intracranial branch is chorda tympani nerve. Function of chorda tympani nerve is twofold. What is it? Now you can see two distinct fibers in chorda tympani. One is the purple colored fiber and one is the green colored fiber. Now if you just trace the purple colored fiber, it is beginning from the anterior two-thirds of the tongue. Right? So it begins from the anterior two-thirds of the tongue, then passes through the lingual nerve, then chorda tympani, facial nerve, then the sensory root, and then it reaches where? It reaches nucleus tractus solitarius, which we have labeled it already. This is about carrying taste fibers from anterior two-thirds of the tongue, which is one of the functions of the chorda tympani. Apart from this, are there any other functions of this? Yes, you can also see some green colored fibers. Now what are these? If you trace it, these green colored fibers actually begin from superior salivatory nucleus, then they traverse through the sensory root, trunk of the facial nerve, leave the trunk of the facial nerve through chorda tympani, joins the lingual nerve, and will relay in submandibular ganglion. This is the submandibular ganglion. And what is this cranial nerve? This is the lingual nerve. Right? So the fibers that are relayed in submandibular ganglion are further relayed to the sublingual salivary gland and submandibular salivary gland, giving rise to secretomotor fibers. So chorda tympani carries taste fibers from anterior two-thirds of the tongue and will also carry the secretomotor fibers to submandibular salivary gland, and then what? The sublingual salivary gland. This is regarding the third intracranial branch, that is chorda tympani. This is regarding all the intracranial branches of the facial nerve. Now let's try to focus on the extracranial branches. The extracranial branches, as we have already discussed, are, what is this? This is the temporal branch. What is the function of temporal branch? The temporal branch will supply the muscles of the scalp, occipitofrontalis, and muscles of the forehead. Right? Then comes the zygomatic branch. So this is the zygomatic branch. Right? This will supply usually the muscles of the lower part of the eye, that is the lower part of orbicularis oculi. Then comes the buccal branch. The buccal branch mainly supplies the muscles around the nose and upper lip. Then comes, what are these? These two are marginal mandibular branches. So we have marginal mandibular branch. What is the function of this? The marginal mandibular branches will supply the muscles around the corner of the mouth or angle of the mouth and muscles of the lower jaw. Right? Then the last muscle or the last branch is the cervical branch. And cervical branch supplies platysma. This is about the extracranial branches which are seen in the face, the 5 terminal branches. Apart from this, as the facial nerve exits the skull, we can identify few branches. What are they? Now just observe here. This is referred to as the posterior auricular nerve. Right? So this is posterior auricular nerve, which is the first extracranial branch of facial nerve. This will supply the muscles of the auricle. Right? Then we can see two branches here. Now, what are these two branches? These two branches are branches to the digastric muscle and stylohyoid muscle. Fine? So, as soon as the facial nerve exits the skull, even before it enters the parotid, it gives a posterior auricular nerve which will mainly supply the muscles of the auricle, and it will also give off a branch to digastric and stylohyoid. After this, it enters the substance of the parotid, and within the parotid it will divide into these 5 terminal branches which will supply all the muscles of facial expression. This is regarding the branches which are given off in the face, also known as the extracranial branches of facial nerve. Right? Once we have learnt about the branches, let's try to focus on the clinical anatomy of facial nerve. Injury to facial nerve leads to paralysis of the muscles of facial expression. The injury to facial nerve can occur at 3 important levels. These are known as supranuclear lesions. When the name suggests supranuclear, the lesion is above the level of the pons. These are also referred to as the upper motor neuron lesions of facial nerve. Right? Then we have nuclear lesions, which are characterized by injury to the pons, where we have the facial nerve nucleus. And then we have something referred to as infranuclear lesions. And these are typically the lower motor neuron lesions of the facial nerve. The infranuclear lesions of the facial nerve are given a special name, and this is referred to as Bell's palsy. In particular, when we cannot locate the cause, when we cannot identify the cause, idiopathic infranuclear lesions are often referred to as Bell's palsy, and this is the classic appearance of the Bell's palsy. Fine. Now let's try to understand the anatomical basis for this. Now what happens in Bell's palsy or the infranuclear lesions? As we can see, what happened in this case is when the person is trying to close the eye, he is able to close the eye, which is normal. So which side is affected here? The affected side is this. That is the left half of the face. How do I say this? There is inability to close the eyelids. Closure of eyelids is the function of the orbicularis oculi, which is supplied by facial nerve. So these are some of the important clinical features of Bell's palsy. Inability to close the eyelids on the affected side. Right? Then there is loss of nasolabial fold. You can see this, right? This is the nasolabial fold. Absence of nasolabial fold on the affected side. Then, if you observe the angle of the mouth on the normal side. Now, listen to this carefully. The angle of the mouth is deviated to normal side. Why? Because the muscles acting on the angle of the mouth on the affected side are functionless. So, the corner of the mouth is pulled towards opposite side. This is one important feature you need to remember. Right? When you want to locate which side of the facial nerve is affected, whether it is right-sided facial nerve or left-sided facial nerve, always look for angle of the mouth. If the angle of the mouth is deviated to one side, the opposite side is the one which is affected. And what is the reason for this? The muscles which need to act on opposite direction are paralyzed. Right? So these are some of the important features of facial nerve palsy. Right? Now, how do we differentiate between upper motor neuron lesion and lower motor neuron lesion? Remember, in case of lower motor neuron lesion, the ipsilateral half of the face is involved. Now, what do I mean by this term ipsilateral? Right? Imagine if there is a right-sided facial nerve injury that is below the level of pons. This is what we refer to as lower motor neuron lesion. And in this cases, what happens is the entire half of the face, starting from the upper part of the face to the lower part of the face, the entire half of the face on the same side of injury is paralyzed. But when we talk about upper motor neuron lesion, that is lesions above the nucleus of facial nerve, the peculiarity here is the contralateral lower half of the face. For example, if my right-sided cortex is injured, right-sided brain is injured, the left lower half of the face is affected. Now let's try to understand how this happens. In order to do this, what we'll do is, we'll take a section of the face, we will divide it into right and left half, and we'll divide it into upper and lower half. Now first, let's try to locate the position of the nuclei. Let's imagine this is the facial nucleus. Facial nucleus, or to be more specific, the motor nucleus of the facial nerve present in pons. From this nucleus present in pons, we have the lower motor neurons which will supply the upper half of the face, the muscles of the upper half of the face, and then there are fibers which will supply the muscles of lower half of the face. Now these fibers have to be controlled by the upper motor neurons which are present in the cerebral cortex, right? So let's try to draw the right-sided cerebral cortex, and let's imagine we have the left-sided cerebral cortex, right? Now, as we know, these lower motor neurons are always controlled by upper motor neurons of the opposite side. For example, the lower motor neurons of the right facial nerve are controlled by upper motor neurons of the left cerebral cortex, right? So this is true even for the fibers which will supply the upper half of the face, right? Done. Now imagine I'm cutting through these fibers, the lower motor neurons. What do you expect? Denervation of the muscles on the same side. So this is why whenever we have lower motor neuron lesion, the entire half of the face is paralyzed, right? Imagine I'm cutting through here. I have cut through all the upper motor neurons of the left cerebral cortex. What do you expect? Again, you expect paralysis of the entire half of the face, but on the opposite side. But this will not happen. What will happen is, only this portion of the face is involved in the upper motor neuron lesion. What is the reason for this? Remember, the fibers which supply the upper half of the face are even controlled by the upper motor neuron coming from the same side. This is why whenever we have upper motor neuron lesion of one side, the upper half of the face is spared, because the lower motor neurons which are innervating the upper half of the face are even controlled by the upper motor neuron of the same side. In simple terms, what we can say is, the upper half of face has bilateral cortical representation, right? It is controlled by upper motor neurons of both the sides. That is why usually the upper half of the face will be spared in upper motor neuron lesions. This is what you need to understand regarding the anatomical basis of involvement of contralateral lower half of the face in upper motor neuron lesion and ipsilateral entire half of the face in the lower motor neuron lesions. Hope this is clear now, right? Once we have learned this, let's try to focus on how to identify the site of lesion. Imagine you are sitting in your clinic, a patient walks in and complains of weakness of muscles of the face, and as you see him, you can see that this is a clear-cut case of the facial nerve palsy, right? But what you need to identify is, what is the exact site of lesion? When I mean by site of lesion, whether it is involved in the pons, whether it is involved above the pons, right? If it is involved below the pons, what might be the site of injury? Is it at the level of genome, below the genome, outside the genome? Like, how do you locate it? Imagine as a patient walks in, if only the lower half of the face is involved, it is a clear-cut case of upper motor neuron lesion. The lesion is well above the pons. If the patient presents with involvement of entire half of the face, the first thing you need to understand is, this is a lower motor neuron lesion and it is well below the level of pons or at the level of pons. Now, the symptoms and the clinical features that the patient presents with will give you a clue regarding the exact site of lesion. Imagine the patient has come with the paralysis of entire half of the face on one side, let it be right side or left side, and he complains of loss of tear secretion, right? Loss of lacrimation, loss of glands secretion from the palate, that is dry mouth, right? Absence of taste secretion. Where do you think the site of injury is? The site of injury should be well above the level of genu, isn't it? If lacrimation is involved, these fibers need to be cut. So the lesion is above the genu. Now let's take one more example. The patient presents with facial nerve palsy. He presents with the symptom of hyperacusis, loss of taste sensation from the anterior two-thirds of the tongue, but his lacrimation is intact. Where is the lesion? The lesion is below the level of genu. If the patient presents with intact stapedial reflex but loss of taste from anterior two-thirds of the tongue, where is the lesion? Yes, it should be below the level of origin of nerve to stapedius. Then we'll go one step further. The patient has intact lacrimation, intact stapedial reflex, intact taste sensation from anterior two-thirds of the tongue, but still has paralysis of muscles of the face. Where is the lesion? It should be below the level of origin of chorda tympani. This is why the level of origin of each branch and function of each branch and area of distribution of facial nerve is very crucial. Even without doing an investigation, just based on the clinical features, you can exactly locate, at least point towards the possible site of lesion of facial nerve. Right? So this is how you need to identify facial nerve lesions. Remember, if only lower half of the face is involved, the contralateral upper motor neurons are involved. If the entire half of the face is involved, it is the lower motor neuron lesion, and based on presence or absence of lacrimation, then stapedial reflex and taste sensation from anterior two-thirds of the tongue, you can clearly tell whether the facial nerve is injured above the genu, above the nerve to stapedius, or above the chorda tympani. Right? This is how we identify the site of lesion in case of facial nerve. Right? Done. There is an interesting syndrome that is associated with facial nerve. We call this as crocodile tear syndrome. The name itself is interesting, right? Now, what do we mean by crocodile tears? Right? Now, there is a common myth that the crocodiles will cry after eating their prey, right? Or during eating, they cry. This is what we know as crocodile tears. Why it is called crocodile tear syndrome? This is a syndrome in which the patient actually has excessive lacrimation during eating. It appears as though the patient is crying when he is eating. That is why it is referred to as crocodile tear syndrome. Now, why this happens? Remember, the crocodile tear syndrome occurs usually after injury to the facial nerve above the level of genu. Now, why this occurs? Once this injury occurs, there is a phase of recovery. During this phase of recovery, what happens is the fibers that are destined to go towards the submandibular salivary gland. In this image, it is shown in green color. These fibers are arising from where? It is arising from superior salivary nucleus. Right? Normally what happens is these fibers should innervate salivary glands. But in case of injury to facial nerve above the genu, these nerve fibers, secretomotor fibers to the salivary gland are misdirected. Okay? Remember this. We call this as misdirection of the fibers. Instead of going to submandibular salivary gland, what they do is these green fibers, they instead go into pterygopalatine ganglion, and through the postganglionic fibers, they supply lacrimal gland. So every time you eat, instead of stimulation of submandibular salivary gland, there is stimulation of lacrimal gland. Because of this aberrancy or misdirection of secretomotor fibers to the lacrimal gland, the patient will appear as though he is crying during eating. Instead, this is because of excessive lacrimation. And this is what we know as crocodile tear syndrome. What are the things you should remember? Crocodile tear syndrome is a complication following recovery of injury to facial nerve above the level of genu. What is the cause? The cause is misdirection of the fibers. The secretomotor fibers, instead of going to submandibular gland, they go to lacrimal gland. Right? Then, what is the clinical feature? Every time the patient eats, instead of salivation, there occurs lacrimation. So this is what we know as crocodile tear syndrome. One of the interesting complication or clinical condition associated with facial nerve and its injury. Let's try to summarize the entire facial nerve. We learned the entire facial nerve under following headings. We described a little bit about its introduction, where we said it is the 7th cranial nerve, and also the nerve of the 2nd pharyngeal arch, and is a mixed cranial nerve. Then we identified the functional components. We said that there are 4 functional components in facial nerve. What are they? These are special visceral efferent column, general visceral efferent column, special visceral afferent column, and general somatic afferent column. Right? Then there is deep origin or nuclear origin. The nuclei which are associated with facial nerve are, we have the motor nucleus, right? Then we have the superior salivatory nucleus and also the lacrimotory nucleus. We have the nucleus tractus solitarius, and we have the spinal nucleus of trigeminal. Right? Then we discussed about the superficial origin. In superficial origin, we said that the nerve arises from the brainstem at the pontomedullary junction. It arises by 2 roots, sensory and motor. The sensory root is otherwise known as the nervus intermedius, and it is attached to the pontomedullary junction between the abducent nerve medially and the vestibulocochlear nerve laterally. Then we discussed about the course and relations. In course and relations, we said that it has an intracranial course and extracranial course. Intracranial course further we divided and learnt as cisternal part and then intratemporal part. Intratemporal part was further divided into 4 segments. These were meatal, then labyrinthine, tympanic, and mastoid. Right? Extracranial course gave 5 important branches, 5 terminal branches, whereas intracranial had 3 branches. So what are the branches? Branches again we discussed as intracranial and extracranial. Intracranial we had greater petrosal nerve, nerve to stapedius, and chorda tympani. Extracranial, posterior auricular, nerve to posterior belly of digastric and stylohyoid, and then 5 terminal branches: temporal, zygomatic, buccal, marginal mandibular, and cervical. Of these 5 branches, the marginal mandibular branch is usually 2 in number, and buccal is usually single, contradictory to what is given in our textbooks. After branches, we discussed about the clinical anatomy. We discussed how to differentiate between supranuclear and infranuclear lesions. Supranuclear lesions are also referred to as upper motor neuron lesion, which is characterized by involvement of contralateral lower half of the face, whereas lower motor neuron lesion or infranuclear lesions are affected or characterized by the involvement of ipsilateral entire half of the face. We also discussed the reason for this. The reason for involvement of the entire half of the face and lower half of the face in upper motor neuron and lower motor neuron lesion is bilateral cortical representation of the muscles of upper half of the face. Right? We also discussed about how to identify the site of lesion of facial nerve. Once we differentiate between upper motor neuron lesion and lower motor neuron lesion, the next thing is to learn whether the patient has absent lacrimation, absent stapedial reflex, or absent taste sensation from anterior 2/3 of the tongue. Based on these 3 features, we can tell whether the lesion is above the geno or below the level of origin of nerve to stapedius or below the level of origin of the chorda tympani. This is regarding the detailed anatomy of this facial nerve. That's it for this session.